Hi to everyone, I'm Muriel, and this year I'm doing my bachelor thesis in the general topic of computational neuroscience. A few months ago, I decided to do my project in collaboration with EDVABS and Hospital Clinic, specifically with the field of neuroimaging research applied to psychiatric diseases. So, my bachelor thesis is named Longitudinal Changes in Resting State Network Connectivity in Youth at Familiar High Risk for Schizophrenia and Bipolar Disorder. To have a little bit of background, you have to know that schizophrenia and bipolar disorder are two psychiatric disorders which show high heritability. For that reason, I will study a dataset of child and adolescent offspring of diagnosed patients which are at high risk of developing these and other psychiatric conditions. In this context, the aim of my thesis is to longitudinally evaluate the functional connectivity in multiple networks during resting state fMRI. Also, I will compare three groups: those who transition to psychosis, with those who do not transition, and also with healthy patients that are the controls. So, knowing the goal, the steps in order to perform the analysis will consist of using an MRI images dataset of a longitudinal study that contains healthy controls and offspring of patients with psychiatric conditions. Then, once all this data is checked and approved for the study, what means organizing the acquisitions and performing a quality control, the next step will be to pre-process all the images. For that, I will be using an established and homologated pipeline, which is called fMRI prep. Finally, I will make a multiple statistical analysis, probably using mixed linear models to study changes in connectivity between the regions of interest and within different groups. So then, after doing all this analysis, what I expect to see is that there are functional trajectories within network connectivity that differ in relation to age and the development or not of symptoms, and also I wait to see functional abnormalities with different neural networks that precede the onset of symptoms. So, to sum up, what we expect to detect are anomalous connectivity patterns that could constitute risk biomarkers for these two psychiatric disorders, schizophrenia and bipolar disorder.